Good evening, everyone, and thank you so much for joining us tonight. Before we get started, I would like to read the brief disclaimer that you can see on your screen now. And the disclaimer says this: the PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to say welcome again. Thank you so much for spending your evening with us tonight. Welcome to the PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. As always, the PharmAssist program takes place every Monday at 7 p.m. EDT. Tonight, we will be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. You can join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format, whether in the chat or directly into the Q&A. So as always, we are joined by various amazing HCPs each week from across the nation to provide you with the real world experience, just as if you were actually sitting in their clinic right across the table from them. And today we are joined by Laurel Meier. So I want to thank you so much for your time and your interest this evening. And now I would like to turn it over to Laurel. Take it away, Laurel.
Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Menopur. Menopur comes in little powders, and we're going to use our imagination and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Menopur. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Menopur. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Menopur and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe, and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in a sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it. All right. That was Menopure. So any questions come in on that?
Yeah, looks like we have a couple. So the first question is, how do you store your Menopure?
Okay, so Menopure can be stored either in room temperature or in the refrigerator. Either one is fine. You just want to protect it from extremes. So don't leave it in your car in the summer or the winter. Just keep it at a moderate, room temperature, refrigerator temperature. Do not freeze it. And then do not mix it until right before you're going to give it. Those would be the suggestions for storing it.
Perfect. Okay, and looks like the question is, how actually does Menopure work? Like, what is the, how does it, what is it doing and helping with your system and helping your follicles grow?
So Menopure is purified FSH, or follicle stimulating hormone, and LH, or luteinizing hormone. And these two medications work together in stimulating the ovaries to push them to produce multiple eggs for an IVF cycle. So in a typical, like a natural cycle, FSH and LH are released from the brain. They stimulate the ovary, and the goal is one healthy, mature follicle and potentially ovulation. But when we give it as a medication, as in Menopure, we give it in much higher doses than is naturally occurring in your body. So it pushes all of the antral follicles to stimulate to the mature state, so we can get as many eggs as possible at egg retrieval.
Perfect. That was a really good explanation. And then what happens if you happen to miss a dose? Do you make up for it the next morning? Do you double it up? What would you do if someone missed a dose?
Oh, good question. So my recommendation would be to set a cell phone alarm for all of your shots, so that doesn't happen. However, we're human. We're bound to make mistakes, and clinic knows this, and you're just, it's bound to happen. So if for some reason you do forget to take your Menopure shot, you're going to take it as soon as you remember, and then you're going to call your clinic and let them know what you did and what time you gave it, and then they'll give you instructions on what to do next. It will not ruin your cycle. Don't worry about that. It's just, if things happen, and this is not something that's going to ruin your cycle, won't make or break it. So just give your shot when you remember and call the clinic. Communication's the key.
I always tell my patients that their stress is worse than anything of them missing that one dose. So I totally agree.
Absolutely.
And then another question that came in is, what happens if the the Menopure doesn't look like it's still dissolving, if there's some bubbles or some clumps when you dilute the medication?
So when you mix the Menopure, you want to make sure that you don't shake it vigorously, because that's going to create a lot of bubbles. But if you do forget or do that, just set it on the counter and those bubbles will dissolve over time, and then you can draw it up and give it. If you mix it and you still see clumps of powder, then something's wrong with it, because this medication dissolves instantly as soon as liquid touches it.
Perfect. Okay, I think that is all the questions that I see, unless you have any more input or thoughts. If not, I'll get us ready for the second video.
Okay. Let's see. I don't think I have anything more to add about Menopure. I mean, I do think that it's important to realize that because it's stimulating the ovaries, it's going to cause your ovaries to swell. And when you have swollen ovaries, it feels like you have a couple of rocks that you're carrying around in your pelvis. That's very normal, very common. You're going to have some bloating. You're going to have some tenderness. You're going to want to wear your loose pants. And you can have some moodiness, some irritability. You might cry for no apparent reason. So don't be surprised if you get these side effects, and no reason to be alarmed about them. All right, so the next video is going to be the trigger shot. It's called Avadril. Are you ready to cue that up, Morgan?
Yes, ma'am. I am getting it now.
Hi, my name is Laurel, and today I'm going to show you how to inject the Avadril trigger shot. The Avadril sugar shot is used to stimulate the final maturation of the eggs in preparation for the egg retrieval. What happens is you give this shot approximately 36 hours prior to the egg retrieval, and it will stimulate the eggs to loosen from the inner follicle wall, so your egg retrieval can be successful. Please make sure that you take this shot at the exact time that your clinic tells you to. So to give this shot, you're going to take it out of the box. It comes in a pre-filled syringe, so it's super simple. You just point it toward the ceiling, give it a few flicks, take off the top, and then you want to get rid of that air that's at the top. So you're going to push on the plunger, and you're going to get rid of the air until you see a little drip of liquid at the tip, like that. Now to give the shot, you want to pick a spot in your abdomen, and you can pick any spot you'd like, as long as it's at least an inch away from the belly button, and there's some fatty tissue to squeeze. So this is going to be my abdomen for the demonstration, and what I'm going to do is just give it a good pinch and hold it at a 90-degree angle. I'm going to go in quickly like a dart, let go of the pinch, and then I'm going to inject the medication. Once the medication is completely given, you want to wait about 3 seconds. Take a Kleenex, pull out quickly, and hold your skin with the Kleenex. After about 10 or 15 seconds, you'll check your skin. If it's dry and not bleeding, you're done. If you do see some liquid, or if it's bleeding, you're going to hold it a little bit longer. Recheck it. If it's dry, then you're all done. Now to get rid of this, you're just going to drop it straight into your sharps container without recapping. And that's all there is to it. Okay, so Avadril, the trigger shot. Any questions that come in about that?
Yes. So someone wrote, why and what's the difference, or why would someone choose Avadril over an HCG injection? They're different types of triggers.
Oh, good question. So there are several different types of triggers. You can trigger with HCG. The brand names are Pregnol and Novaril. It comes in 5,000 units and 10,000 units. You can also trigger with what's called Lupron or leuprolide acetate. Either 4 milligrams or 5 milligrams is common. And Avadril, see, depending on, there are several factors that go into why your provider chooses which trigger to use for your cycle. Lupron is usually given if you have a large number of eggs and you have a high risk or a higher risk of ovarian hyperstimulation syndrome, which is when the ovary gets super, super swollen. Lupron is going to be given in this instance because it's going to decrease that risk for OHSS. Avadril is approximately equivalent to 6,000 units of HCG. It's very convenient, user-friendly. It's in a pre-filled syringe, so it's gonna work for almost all cases. So it's a very common trigger. And HCG, the Pregnol or Novaril, is nice because you can adjust how much you're giving. You can either give 5,000, 10,000, or anywhere in between, or even less if you need to. So the purpose, so they all work the same. Basically, it takes about 36 hours for them to do the job that they need to do. And what they're doing is, as I said, all the eggs, those microscopic eggs are stuck on the inner follicle wall. And the trigger's job is to loosen the egg so they're free floating in the follicular fluid. So when you go in for your egg retrieval, the doctor inserts the needle into each follicle and drains the fluid out. The egg will flow along with the fluid down the tubing and into the test tube, and then those eggs can be handed over to the embryologist and isolated and put in the culture media. So 36 hours is sort of the ideal or the average number of hours that this takes to happen. You want to give it at the time that you're told to, because if you give it too early and too much time has passed, you may ovulate. The eggs are lost in the pelvic cavity. You can't retrieve them. If you give it too late, the eggs can still be stuck on the inner follicle wall, and you can't retrieve them there either because they're still stuck. So really important to give it at the time that your clinic tells you. And so that's about it on triggers. Any other questions?
Yeah, that's so funny. You really went into the next question. Someone wrote, how exact does the timing need to be with your Ovidrel? But I think you kind of just hit on that. And then
yeah, I can mention one other thing about that. So I tell my patients, set a cell phone alarm. You're going to want to set it for about 5 or 10 minutes before you're supposed to give your shot, and give it within 5 minutes, plus or minus 5 minutes of the time you're told. And if you forget, and we're human, it happens. It's not necessarily going to ruin your cycle, but it is very important to give it on time. If you do forget, give it as soon as you remember and call your clinic, because they may need to adjust your egg retrieval time. So it's just super important to keep that communication open with your clinic, and they can tell you what to do.
No, I totally agree. And then looks like another question is, what are possible side effects of the Ovidrel shot?
So yeah, Ovidrel can cause nausea, headache, fatigue, and irritability. I would just know that those are fairly common, and to expect something like that. I don't think there's a reason to notify the clinic for any of those symptoms. However, if you just get super, super bloated, really, really uncomfortable, and your stomach is really, really sore and bloated, then I would contact your clinic for that.
Perfect. Okay, it doesn't look like we have any other questions as of right now, so I'll get us loaded up for the next video.
Okay, awesome. Thank you. So the next one we're going to talk about is the Sonera patch, which is a really nifty patch that numbs your skin so you don't feel the poke of the needle. So anytime you're ready, go ahead and start that video, Morgan. Hi, my name is Laurel, and today I'm going to show you how to use the Sonera patch. The Sonera patch is used to numb the site before you give an injection. It can also be used for an IV start. It can be used for a lab draw. So whatever you need for, it numbs the skin. So what you're going to do is you're going to open up your package and pull out your patch. It's a combination of lidocaine and tetracaine. It is activated by heat, and it gets the medication into your skin using the heat. So what you're going to do is pull this back. The medication is in the middle, so you don't want to touch that part. You want to make sure that the place where you're putting the patch for your injection is clean and dry. And then you're going to place that right on the area where you want to give your shot. Make sure that you don't cover these holes, because they do need to stay open to air to activate. And you're going to leave that patch on for 20 to 30 minutes prior to giving your shot. Once 20 to 30 minutes is done, you pull it off. You place your one-time use patch right on the cover, and you'll notice that it feels warm, because once it's pulled off, that warmth activates it. And then you're ready to give your shot in that exact spot where you had your patch. And you probably won't even feel it. That's all there is to it. All right, so the Sonera patch, pretty nifty way of numbing the skin. Any questions come in on that one, Maureen?
Yes. Someone wrote, can you use the patches multiple times for like different multiple injections?
Unfortunately, it's a one-time use deal. So the short answer is no, just one time.
True. I've had a patient who they kept it on and tried to do multiple shots, and like it's not working. And I was like, well, they're only one-time use. Okay. And then how long will your skin usually feel numb after removing a patch?
I would say that it'll probably last under an hour once you remove it. I don't think it lasts too long. Just, you know, it goes away pretty quickly. Oh, I have a neat little thing that I just found out about. Um, I don't, hopefully it lasts at least an hour for this purpose, but I found out that the Sonera patch can actually be used prior to having a tattoo removed to remove the pain. Did you know about that?
No, I did not. But one of my nurses, she's asking if she could use it to get a tattoo prior to
That's a
help
good
with that.
question.
So
You know the
yeah.
answer to that?
No, she I don't know, I should follow up with her. I don't know if she ended up doing it or not. But that kind of goes into kind of another question too. Can something go wrong if you leave it on too long?
Yeah, the short answer is no. They did studies where they put multiple patches on for several hours and didn't have any adverse effects. So no, actually, I mean, it's always a good idea to just leave it on the 20 to 30 minutes because there is a very, very minimal risk of it absorbing into the bloodstream and you getting some side effects of that. But it's extremely, extremely rare.
Perfect. And then can you also use the Sonera patches for like blood draws if you have like a needle phobia, like to get when you get multiple blood draws for infertility patients?
Absolutely, yeah. This can be used for blood draws or IV starts um, or injections. So yeah, whatever you want to use it for in the IV world for those shots, for those sticks, you can use it.
Yeah, such a really cool medication. And then last question I see as for right now, unless more come in, is do you know what makes it that feel warm or makes the snare patch heat up?
Oh yeah. So it is impregnated with an iron ore. So as soon as oxygen hits that iron powder, it will start to heat. And then that heat pushes the lidocaine and tetracaine into the skin so that it works pretty fast.
Awesome. Okay. I don't think there's any more questions. Let me just check the Facebook feed. Yeah, I don't see any other questions for right now. Do you have any other comments or anything with any of the medications that you can think of?
No, I don't think I have anything to add. It's just really nice that we could uh, help you tonight, and I hope that you feel like you got something out of this. I apologize again for the delay. Technical difficulties happen, so thanks for bearing with us.
And I'd like to thank everyone for joining us again. Like Laurel said, I'm so sorry for the technical difficulties. Gotta love technology sometimes. But again, thank you for joining us through Zoom or Facebook and then sharing those excellent questions. I hope we helped you and gave some clarity through those medications because we know how scary it can be when you get that huge box of meds and how it can be kind of overwhelming. Just want to remind everyone that we do post these videos, learning experience videos on our Facebook and YouTube page. So if you want to watch it again or kind of forgot what we talked about, you can always click on those as a quick refresher. And lastly, that we just do these every Monday at 7 p.m. Eastern Standard Time. And we do new medications each week. So we would love for y'all to join, share this if you have any friends going through this as well. And we hope to see y'all again soon. Thank you, everyone. Have a great night.
All right, thanks. Take care. Good night, everyone.